So I think tucatinib is one of the most exciting agents out there in the HER2 space, or things that are being studied to improve on current therapies for the treatment of HER2 positive breast cancer. So the data out of San Antonio, and we had seen some of this data earlier in the year in different forms, demonstrated that if you give tucatinib, a small molecule inhibitor, very specific against HER2, if you give this prior to a patient receiving whole brain radiotherapy in patients who were facing brain metastases that had not received radiation, so really eliminating the effects of radiation on your ability to detect a response rate to tucatinib, these tumors, these patients who had tumors in their brain that were HER2 positive, there was a demonstrated objective response rate prior to radiotherapy. And to me, that's very, very exciting. That tells me that maybe we can kick the radiation can down the road, in particular the whole brain radiation therapy, move it further down the patient's treatment course, and use these very tiny small molecule inhibitors to treat HER2 positive brain metastases. I think the other thing that most of us are excited about with tucatinib, and it differentiates it from some of the other multi-HER inhibitors such as neratinib and lapatinib, and even some of the ones that we use outside of the breast cancer space, is it is such a pure small molecule inhibitor. It doesn't have some of the side effects that are problematic for our patients, including the most problematic one, which is diarrhea. And to my knowledge, the rash that patients receive while they are taking tucatinib is of much less intensity than what we see with some of the other HER2 inhibitors. So it's kind of a very exciting drug, one, because it appears to work and get into the blood-brain barrier space, and that's important for patients facing HER2-positive brain metastases. And two, it looks like its toxicity profile is quite nice, with very low incidence of diarrhea and very low incidence of rash. And that, in particular feature, the low side effect profile, is going to make it a very exciting drug to combine with standard chemotherapy as well.